Universal health care is a key campaign promise for many Democrats running for president, but there isn't exactly consensus about how to get there.
The future of this country rests with Medicare for all.
The most immediate way to do this is a public option, either with Medicaid or Medicare.
Medicare should be there for everybody in this country. It's time for Medicare for all.
There is no role for private insurers after you do this. That's the answer. There is no role left because you don't want to pay a middleman.
A proposal called Medicare for America. If you don't have insurance or you don't like the insurance you already have, you enroll in Medicare.
Polls show Democratic voters are focused on reforming health care, with 82% saying it should be a priority in Congress. But when you get down to details, the party's voters are just as all over the place as its politicians, with 74% of Democrats supporting Medicare for all, but just 54% of the same voters supporting Medicare for all if it means getting rid of private insurance, which in some versions it does. My next guest is a former advisor to Barack Obama and one of the key architects of what currently exists, Obamacare. He's also an oncologist, a medical ethicist, and the author of this piece in The Atlantic, Why I Hope to Die at 75. Ezekiel Emanuel is also a senior fellow at the Center for American Progress and the chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. He joined me at the end of last week. Ezekiel Emanuel, good to see you.
Great to be here.
Oh, and the father of Gabrielle Emanuel, a great reporter in the GBH newsroom. So you support expansion of Medicare, Zeke, but you do not support the elimination of private insurance. How would you do it and why?
Well, I'm against. Look, I don't want to fail, right? I want to succeed. And I think if you propose to get rid of private insurers, you're not going to get a bill passed. I think it's
politics.
Just that. The politics
Harry and Louise,
of it.
the sequel.
Exactly.
Okay.
Redux.
Okay.
And if people don't believe it, go to the web, go to YouTube, and look at the Harry and Louise ads. They sunk Clinton Care. I lived through that. I was on the Clinton Healthcare Task Force. I don't want to go through that again.
So what would you do?
I want to pass something.
What would you do?
So I think we can boil down our system to one of three options. Either your employer gives you insurance, as the employer does now, through a private insurance program. Or you're on traditional Medicare, Medicare fee-for-service. You can select that. Or you can select what's called Medicare Advantage, where private insurers offer managed care plans. That option, which is called Part C, Medicare Advantage, is the most popular part of Medicare now. It's at a third of all Medicare recipients want it, and it's going up to 40% in the next few years. And that keeps a role for private insurance, but it also gives people who don't want it a free choice to go into traditional Medicare.
And the shorthand, that's the Medicare for America thing that Beto.
That's right.
Did you write that?
I helped work on it at the Center for American Progress. The main person behind it was a guy named Topher Spiro, who heads their healthcare group.
Every Thursday, Chuck Todd from Meet the Press is on our radio show, and we were talking about Medicare for all about maybe 3 weeks ago. He says something like, I'll do my best Chuck Todd imitation, fix what we currently have before you worry about something else. Could we fix what ails the healthcare system without doing a pretty radical reform like some form of Medicare?
Well, I don't know that Medicare for America is that radical a reform.
I'll withdraw the adjective.
Okay.
Could we fix the Affordable Care Act? Would that be enough or no?
We could absolutely fix the Affordable Care Act, but remember, the Republicans have gone a long distance towards undermining it, getting rid of the mandate, getting rid of the subsidies for cost sharing like co-pays for lower-income Americans, reducing the navigation on the exchanges. And let's be honest, the exchanges have done well, but they haven't done fantastically well. You know, my hope when we pass the Affordable Care Act is they would be so wonderful. They'd be like, REI or like Amazon on the web, and everyone would want to flock to it. The shopping would be, it just hasn't turned out that way. And I think that makes people say, well, you know, I'm worried. If we rely on that, the Republicans might come in and undermine it again. Medicare, no one's undermining, and that's a safety net. And I think fear is driving a lot of people. I want something safe. Will be guaranteed whether there's a recession, a depression. And that, I think, is what's driving people to the Medicare option.
You don't think they're going to be more scared of something new than fixing what is, especially since support for the Affordable Care Act has grown?
Well, the reason I don't think it's all that new is because it's two existing programs already, traditional Medicare and Medicare Advantage. And so it's not that new.
While you have written that the Affordable Care Act is a success, you've focused on three things that have not been a success: still exorbitant drug prices, absurd deductibles, and absurd co-pays. Let's start with the latter two first. How do you fix those two?
Well, first of all, I think you can cap them, and I think actually insurers are moving in a direction towards lowering the deductibles and narrowing the network so that you only get really good performing doctors and good performing
Why are
hospitals.
they moving in that direction?
Because I think most people are, including the insurers, are dissatisfied with the high deductible plan. It leads to irrational behavior by most people, including me. I have a high deductible plan, and you keep putting off things you know you should be doing.
So you're less healthy, which ultimately costs them more? Is that the theory? Because it is about the bottom line.
I don't think it's ultimately cost them more, but people aren't getting the health care. They're not getting the things they should get.
Since when are they? I mean, public spiritedness is now part of their game plan?
No, I think they do want people. So their philosophy is keep people healthy, and it will reduce costs. And I do think they're seeing that people are not using their the healthcare system in the right way with high deductibles.
So you think they'll fix that themselves? Is that where you're
They're
going with this?
all of them are already on that path.
Okay, let's move to drugs. When you were on the radio with us, I made the big mistake of saying that I really loved what candidate Trump said, let's import Canadian drugs, let's allow Medicare to negotiate drug prices, and you politely or impolitely said to me, that will fix virtually nothing. What will fix? I mean, everybody knows about the Heather, what's her name, Bresch from EpiPen, that Shkreli's scum, whatever he is, who's now in, Shkreli, pardon me, who's now committed some other felony, so he's in jail, at least for a while. What would deal with these exorbitant drug prices, which are the major element in the increasing cost in healthcare, yes?
They're definitely a key driver in high healthcare costs. And the thing we have to do is have national price negotiation, not just for Medicare. The problem of just focusing on Medicare is that there are 60 million people in Medicare. There are 175 million people who have private health insurance. And if you just fix it for Medicare, you might actually make it worse for people who have private health insurance.
So what do we do?
So we have to have national price negotiation for the whole country. And the reason we have to do that is drug companies have a monopoly. We give them a monopoly. We give them a patent, and we give them marketing exclusivity on their drug. We should limit the prices they can charge, because we know when someone has a monopoly, the sky's the limit. Now, we don't have to do that through the government, and this is a point I think is really important to make. In Germany, they have price controls too on drugs, but they don't do it through the government. They empower a joint commission to negotiate, to evaluate the drugs, and then negotiate prices. We could do the same. We could make an independent commission that's got representatives of hospitals, doctors, patients, all sorts of groups, and they could negotiate the prices informed by, I think, value is important. The more important you are for health, saving a cancer patient's life, the higher the price you should get. On the other hand, if you don't really do a lot for someone's health, then you should get a lower price.
Let's spend a minute on the guy whose proposals I used to like until you disabused me. I didn't know till I talked to you on the radio. You've met with candidate Trump and President Trump,
Correct.
A total of 3 times?
3 or 4 times. And I've talked to him on the phone.
People who've met with him on foreign policy have said things like he had absolutely no idea what I was talking about. Did he have any idea what you were talking about?
Actually, on drugs, I think he did understand. I wouldn't say
what the prices were too high.
He's not a health policy expert, but he did understand that they're too high. That we're paying way more than other countries, and that the prices should come down.
But he used as not pre-candidate. He used to support not only universal health care, but government-funded universal health care. What track did you think he was on after these conversations you had with him?
So first of all, I had suggested to him this was an area of bipartisan overlap between Republicans and Democrats, and he should make hay and get a deal. He could have gotten a deal very quickly within the first few months of his presidency if he really wanted to on drug prices. He forsake that. He decided to double down on his base. His base is about immigration, right? It's about lowering taxes, and that is what he has focused on, to the detriment of all the other positive things that could have been done.
So sadly, no collusion
Yes.
with Ezekiel Emanuel,
so
apparently.
Sadly, yes. Maybe I should have spoken Russian.
Why I hope to die at 75. I read it in 2014 when it came out. You were 57 then?
Yeah, I'm 61.
You're 62.
61.
Do you still hope to die at 75?
I hope to stop taking medications that are going to prolong my life at 75. That's what the idea is.
You have kids, you have grandkids.
Yes,
why?
Right. I do not want to have a life where all I'm doing is consuming, and my kids remember me sort of as I'm declining. I'm shuffling. Maybe my mental faculties disappear. I don't want that. I want them to remember me as a vigorous guy, and I will have contributed everything I can contribute probably by 75. Yes.
So you wouldn't do yourself in. You just would not continue any life extending
right.
kind of
Correct.
things.
Exactly.
So,
I'm not committing suicide. I'm not doing euthanasia.
Okay.
The focus is on not taking medicines where the reason is to prolong my life.
Okay, you're a pretty smart guy. Will you agree with that? Okay, fine. Let's do a quiz before you. I love quizzes. What did Joe Biden, Bernie Sanders, and Bill Weld have in common?
They're all over 75.
Exactly, or they at least will be by Election Day. So what do you say, and by the way, Donald Trump by June of the 5th year of his presidency, if he's reelected, would also be 75. What do you say to somebody who's contemplating supporting any of those four men? In light of what you say about post-7, I'm serious.
Well, these men are vigorous. These men are very, they're on the extreme. They are outliers, as we say. But most of us aren't going to be outliers. By definition, outliers are rare candidates, and these are people who are rare candidates. You know, one of the people I study, because I'm at the University of Pennsylvania, right, is Ben Franklin. He's our founder.
Well.
Right. Ben Franklin was one of those unique guys. In his 80s, he wrote and rewrote his autobiography. He was still totally present. That is a rare person. I have a collaborator, Vic Fuchs, who's 95. I was just out with him. He's a rare person. He's still writing. We're writing an article together about fallacies about healthcare. But those are rare people. Most of us aren't rare people. And we should not behave as if we're going to be rare people. I behave, I'm a statistical guy. I'm average. I'm going to have an average life. That's what you do.
By the way, Donald Trump said Ben Franklin's doing a great job. Nice to see you. Ezekiel Emanuel,
thank you.